Welcome to EHR Institute's Intech Brief, where we bring you up-to-date coverage of news that affects EHR professionals. I'm Jeffrey Erb, your host for the show. Healthcare IT News reports that driven by meaningful use incentives and a rebounding economy, nearly 3/4 of respondents to the 21st Annual Healthcare Information Management Systems Society Leadership Survey said that they expect their IT operating budgets to increase in 2010. Last year, only 55% of respondents expected an increase in their budgets. Nearly half who said their budgets would increase this year reported that meaningful use would be a driver. Another 45% reported the increase would be due to an overall growth in the number of system and technologies at their organization. 2/3 expected to increase the number of IT staff, which is consistent with 2008 data after dipping to less than half a year ago. When asked to identify their single IT priority during the next 2 years, 42% of respondents identified meaningful use criteria. Many likely will be doing so by implementing clinical systems. When asked to identify their organization's primary clinical IT focus, 35% said it would be ensuring their organization has a fully functional electronic medical record in place, and 27% said it would focus on installing a computer order entry system. Also in the news, a group of 13 state health information exchanges has sent a comment letter calling for CMS to recognize healthcare providers who already participate in data exchanges as meeting the data exchange requirements for meaningful use of electronic health records. Health Data Management reports federal officials have proposed regulations describing how healthcare providers can demonstrate meaningful use of EHRs to qualify for incentive payments under the 2009 Federal Economic Stimulus Package. In its letter, the coalition said its proposed rule adjustment would promote participation in existing health data exchange networks. The coalition also recommended that CMS allow states to impose state-specific meaningful use requirements that healthcare providers would need to fulfill to receive incentive payments through Medicaid. And finally, Gianna Shaw for Health Leaders Media reports that while you probably picture a large academic medical center or a large hospital system when you think of innovation in healthcare technology, small and rural hospitals are perfectly capable of making investments in new technologies. In fact, one might argue that small rural hospitals that adopt new technologies are even more adventurous than the big guys. They have a lot more to lose. In Health Leaders Media Industry Survey 2010, technology leaders were asked to describe their organization's IT culture. Most, 43%, answered, "Wait until proven." But the second most popular choice was early adopter, with 37% choosing the response, up from 34% the previous year. Another 20% said they are behind the curve. One surprising stat, of those who chose the early adopter response, most were small hospitals. It wasn't an overwhelming majority. Technology leaders from large and mid-sized hospitals chose that response, 23 and 24% respectively. The rest, about 18%, were critical access hospitals with fewer than 25 beds. A CIO from a small regional hospital commented that one main benefit of being an early adopter is the impression on staff, physicians, and the community. The goal is to show them the organization is willing to be a cutting edge, but also that it is doing so in a sensible manner. It shows a commitment to providing the safest and highest quality care that they can in a rural setting. Well, that's all for this segment of EHR Institute's Intech Brief. Don't forget to visit us online and interact with your peers involved in EHR at www.ehrinstitute.org. Thank you very much.